I enjoy going to the gym, and when that became very uncomfortable, impossible, I realized I had to do something. So I went to see Dr. Keller and had him tell me where we needed to proceed from there. I went to see him at his office and had the x-rays done to determine that my hip needed to be replaced. It was about 6 weeks from my diagnosis to my surgery date. And during that time, I had exercises that I did that were prescribed by the physical therapist, what they call prehab, and getting me ready for the surgery, building up the muscle, alleviating some of the discomfort. I could tell from the minute I woke up in anesthesia, you know, there's the surgical discomfort, there's an incision, but the pain that I was having from the hip was gone. I told Dr. Keller the nicest thing that's happened to me is when I forget that I even had it done. I feel like I'm me again. I'm back to doing what I want to do, how I want to do it, and when I want to do it. And that was the most important thing for me, was to be able to live my life the way I wanted to.